Okay. Hi, Awaken finally. Yeah, Awaken finally. Hi, Story Media. Hi, Princess Farm Cottage Living. Ooh, I like that. I like that. Leslie Mindfulness. I love that. D. Barbara. I love that. Good vibes. Yep, I'm feeling that today. Thank you all so much for joining. Loves Brown Eye loves books. Brown Eyes love books. Cool. Elizabeth Young Consulting. I've seen you a lot. Thank you all. Thank you all so much. I wanted to come on here. Oh, I'm right on time. Welcome you to Wham Live. These are conversations about women, Alzheimer's prevention, caregiving, brain health, you name it. We try to cover it here at Wham Live every Thursday. Every Thursday we have what we hope is a enlightening, inspiring, informative conversation about women and Alzheimer's, about brain health, about prevention. But today we have a really special, hi Brain Health Kitchen, Annie Fenn. She is so awesome and such a big supporter of the women's Alzheimer's movement. Thank you so much, Annie Fenn. Anyway, we have a big, super great announcement. We made it today on the Today Show. We have opened the Women's Alzheimer's Movement, WHAM, in partnership with the Cleveland Clinic and the Ruvo Center, have opened the very first Women's Alzheimer's Prevention Center in Las Vegas. Yippee! Oh my goodness. Several years in the making. The Women's Alzheimer's Movement team working so tightly with the Ruvo Center team and the Cleveland Clinic team, all so that we could have this center for you. For you. I'm so excited for you, for us, for all of us, because I have been working in the Alzheimer's space since 2003, in the women's space since 2010, when we reported for the very first time to the nation that Alzheimer's disproportionately impacts women, and specifically women of color, and nobody knows why that is. So we have been funding research, educating women, educating researchers, educating doctors, holding forums. In fact, we have a big summit next week. And people used to always come up to me and say, where can I go? I'm interested in prevention. I'm interested in my brain health. Where can I go if I'm nervous about Alzheimer's? And I never had anywhere to send anybody. And now I do. Now you do. You can go in person, you can go online to the Women's Alzheimer's Movement Prevention Center. It's at the Cleveland Clinic. We're going to put up the pin so you have it there, so you can go, you can sign up, you can get seen by women doctors who know how women age, who know how women's brains are different, who understand how women fare on memory tests, cognitive tests. And this is really groundbreaking. So we're going to talk today to Dr. Jessica Caldwell, who is the director of the center. And she will be seeing patients and she will be leading us forward. And forward we're going, because this is really historic and it's going to make a huge difference in the lives of so many people. And so I'm super excited. Got up super early this morning, had a lot of coffee, to do the Today Show, to announce it on the Today Show, and talked to several reporters about it. And now I'm so happy to be talking to you. So it's called the Women's Prevention Alzheimer's.org. So you can go there and find out all you need to know about it. WomenPreventAlz.org. That'll take you directly to the site. You can sign up, WomenPreventAlz.org. You can go to the Women's Alzheimer's Movement. It will also connect you there. And it's going to make, Smart Girl says it'll make a huge difference. This is an amazing resource. That is true, Smart Girl. That's why you're a smart girl. Where Ha said, I saw it on the Today Show this morning. Wonderful, wonderful, wonderful. Okay, so I'm going to find Dr. Jessica Caldwell, who's going to come on, and she's coming to us live. that's there at the Ruvo Center in Vegas. We have been partnering with them for several years now, funding research there. There she is.
Hi,
Hi, Dr. Caldwell. How are we today?
I'm very excited. Thank you for having me. I don't know if you can see all of this, but I got some great balloons from the women's Alzheimer's movement to celebrate today
Yes.
with the opening. I love them.
Well, this is really a celebration, isn't it? It's a really historic day when we think about prevention, when we think about women, and when we think about Alzheimer's. So, Dr. Caldwell, why is this historic for you? What do you think? How is this a game changer?
Yeah. Well, I think I just want to start by saying, thank you for making this game changer possible and being committed to this for the last 10 years and more. Um, and really supporting me and bringing me to this moment. So I don't know if everyone knows that you've supported my research on sex differences and Alzheimer's disease for 4 years, really
Right.
letting me build the program here, hire a postdoc here. It's been amazing. And to go from that small studies into now big studies and
Yeah.
clinical offerings. No one else has this. And now at the Cleveland Clinic, because of your philanthropy and WHAM, we can really give women a chance to do something about Alzheimer's disease risks years before, decades before symptoms might be happening.
That's so exciting. And you've been kind of at the forefront of this, looking at sex differences. And I always say to people that women's research is decades behind male research, right? And therefore, what we know about how women age is decades behind what we know about men in particular. So, what if someone were to come to the center there? What can they expect, and who should be thinking about coming?
Sure. So our center is really designed for women who are worried about their risk for Alzheimer's disease and don't yet have a diagnosed problem with their memory. So we're
Right.
looking mostly at women at midlife. So people that might have a parent or even a grandparent with Alzheimer's disease, or maybe they know they have a genetic risk for Alzheimer's and are looking to do something now about their health. And I think another important thing is that we're looking for women who are committed to making a lifestyle change. It's something that we will help target, and we will also help women to step through that process. But we need commitment to change because it's difficult to change your life. And that's really what we're asking.
Jessica, when you say you're looking for people who are committed to making lifestyle changes, what does that mean so people understand if they're sitting there thinking? Now, we should also say that you don't have to have a history of Alzheimer's disease. You don't have to have a genetic proponent to it, but you could just be worried about your brain health. And I haven't met any woman who's not in her 40s or 50s who isn't worried about her memory or her brain. And I haven't really met anybody who's not worried about Alzheimer's. But when you say that they have to be committed to making lifestyle changes, what does that mean exactly?
So what our clinic will do is really assess a woman's specific risks for Alzheimer's disease. So we ask a lot of questions about, what things in your life could lead to an increased risk for Alzheimer's or dementia, and also ask about things that we know correlate or research shows relate to poor aging or good aging. And so we're looking for women who are willing to make changes in potentially a broad array of areas. So for example, if we find a woman is eating a diet that's not very brain healthy, we might be asking her to change her diet and really shift towards a more brain healthy diet. That can be a big change. We might ask a woman to start exercising or exercise more than she has in the past. Again, that can be a really big life change. It might be something else too. We're going to recommend to women things about their stress level, about their sleep, about their social connection, their mental activity level. So I think a woman coming to our center needs to be up for making a change in any of those areas. Of course, because we're looking at women at midlife, my goal is not to hit any particular woman with so many changes that it's impossible to make them.
Yeah.
I want to give women a plan to start somewhere and maintain that and have a healthier brain health life.
I think it's also, in building a community, you'll be surrounded by people who are also making these changes. I had to make a lot of changes myself, and also kind of being on my own, it's harder. But if you're at a center, if you're in a group, if you know other people are making a lot of the same changes and choices, it makes it a little bit easier, doesn't it?
It does, I think. And so we will have offerings that I think will women who might be really changing their diet or their physical activity level for the first time. So we've worked with doctoral level physical therapists and nutritionists to put together 12-week classes, one on diet, one on exercise, to really help women kind of get a small community of people who are making the same kind of change and get stepped through those changes. We do also plan and hope to build our online community for women who are interested in risk reduction. So in the coming months, there is a plan to see more happening on our website in terms of ways that women can connect.
So if are there women out there, a lot of women I see are saying, my mom had dementia, my sister or her sister had dementia. What can those women do right now to embark on a brain healthy lifestyle, an Alzheimer's prevention lifestyle? And let me be clear, I'm not saying if you do these things, it's 100% guarantee, right? Nothing is 100% guarantee. It's like having a heart healthy diet. It sets you up better, but it's not a guarantee. There's no guarantee. These things, these changes that Dr. Caldwell is talking about, that the Women's Alzheimer's Movement advocates for, put you in the best possible place and space to prevent Alzheimer's.
Thank you. That's exactly right. So what we're doing is really just helping women to decrease odds of risk and really increase behaviors that are good for your brain. So for a woman who's concerned about risk at home right now, there are things that you can do today that can start to reduce risk.
Like
And
what?
the number one thing that I would say is exercise. And I go with exercise because exercise is really a multitasking problem solver. Increasing exercise increases fitness, which increases heart health, which increases the health of your blood vessels and your brain, blood vessels in your brain. Exercise also reduces stress, which is not good for your brain. And exercise does other things like improving your mood. So again, really a multitasker. Behind exercise, I would list sleep. So a lot of women, especially people at midlife, we're not
Yeah,
sleeping enough.
right.
You might be caring for kids or caring for parents or both at the same time, working full time. There's a lot of pressures, a lot of responsibilities. And so sometimes sleep falls off that priority list, but we know that we need sleep to consolidate new memories. And we also need sleep to clear negative proteins out of our brain, things like amyloid, which plays a role in Alzheimer's pathology.
So that's really interesting and really important what Dr. Caldwell just said. Sleep removes what many doctors call the trash that develops in your brain, right? A way to clean out your brain and a way to make space for new memories. So if you're not sleeping at all, you're not able, your brain is not able to clean itself out, simply put, correct?
That's right. If you're not getting the right kinds of sleep, so enough sleep that has all the stages of sleep that we need, then you're not clearing out that amyloid. And it really is true, even if you don't have amyloid in your brain and you're not at risk for amyloid buildup, if you don't sleep, you won't consolidate memory as well as someone who's sleeping 7 to 8 hours a night.
Wow, so you're talking about exercise, 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 sleep, 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 stress. I have embarked on meditation because it helps me with stress. And there's some research, I should say, that helps, that meditation does help relax the brain. It does help calm down the central nervous system. So these are things, and then diet being incredibly important, Mediterranean diet. And also the doctors at the center will work with you about looking at your blood, looking at your pre-existing conditions. We know that Many times people with type 2 diabetes, people with hypertension are more susceptible to Alzheimer's. So if you have those as pre-existing conditions, it's important to really extra important to start caring for your brain health today, correct?
That's right. And I think even one step beyond that, we know not only do some of those pre-existing conditions increase Alzheimer's risk, if you're a woman, the likelihood that things like diabetes and hypertension actually show up in your brain in a negative way, it's worse, it's a higher likelihood than if you were a man. So if you're a woman, these behaviors and changes can make particularly strong impact in potentially stopping that pathway.
And so also the women that come to the center, I was saying originally that WHAM was born to try to answer the question why 2/3 of all the cases of Alzheimer's are women and why women of color are even more disproportionately impacted. Will the women that come to the center, will they be able to help us as we try to wrestle the answer to that question?
Absolutely. So we will be able to offer research opportunities, and those will change over time and grow. But one of our main goals is really to contribute to our current understanding of why women are impacted more, why we decline more quickly once we're diagnosed. And so we will give all women who come here the opportunity to do something as simple as opting in and saying, yes, please use my data, de-identified, to kind of study that question. But we'll also soon hopefully have some real research opportunities where a woman might be able to come in, do a brain scan, take some additional tests for a different type of study beyond what they would typically do for the clinic.
Dr. Caldwell, I saw a question here. Are you able to take women who have already been diagnosed and are in the early stages of Alzheimer's?
That's also a great question. So our prevention clinic, to do prevention, we need folks who don't yet have memory problems. So if a woman has been diagnosed with MCI or with dementia, she wouldn't be eligible for this prevention clinic. At the same time, she could benefit from these types of recommendations, and we do plan to get some additional resources up on our site soon that are more general. Beyond that, if a woman is interested in our program in Las Vegas, but already has a diagnosis, we have a now 10-year-old excellent Center for Brain Health where we could refer those women to a neurologist in-house who could address those kinds of concerns.
So question here, what ages can participate? For example, mid-40, is that all right?
Yes. So I would predict that most of the women who are interested and concerned about risk are probably at midlife. And when I say midlife, I think of it as a broad range, but I think 40s and 50s will probably be who we see the most. At the same time, if you're an adult woman and you don't have a memory problem diagnosed currently, you are eligible. So as long as you're 18, there's no lower limit beyond that, and there's no upper limit as long as you don't have a memory problem currently.
I think this is also something that's really important that we're trying to push into the mainstream. Most people think Alzheimer's or brain health is something they need to think about when they're 70 or 80. And we have done a lot of work trying to bring this message to women in particular in their 60s, their 50s, their 40s, their 30s, right? Because the earlier you embark on a brain healthy lifestyle, the earlier you know this information, the earlier you make these changes, the better chance you have to age forward really well. I always say, I wish I knew now when I was 40. I wish I knew what I knew now when I was 40. And so the whole point here is for you, if you are in your 30s, if you're in your 40s, if you have a mom in her 50s and 60s, come to the center now so that you can age well and you can age with your brain and your body intact. That's everybody wants to age well, right?
And I think there's a lot of important points there. And one of those is that a lot of research shows that your exercise levels and your diet when you're young are very important for what happens with aging. So even, your diet and exercise when you're a late teenager and in your early 20s. So if a woman comes to us and she's pretty young, you have a chance to really impact that time period that could then benefit you in 50 years. At the same time, what we want women to do mostly is to come in before things like amyloid are building up in their brain. And that usually happens about 20 years or 15 years before symptoms onset. So before you have a memory problem. And that's why we really think it's important to, again, normalize this, like you said, and have women come in when they don't have a problem and make it normal for not just us, but other doctors to really encourage this kind of a prevention practice in younger people.
Dr. Cole, what's your hope for this center when you close your eyes and you kind of think, 5 years out, and even though it's been like, it feels like forever to just get to today, but when you kind of think about your own personal goal for it, what is it?
I think I have a few, and the number one goal is really improving the practice of prevention here. And so one of our big drives will be following women over time to see if they liked our recommendations. Could they enact our recommendations? And did those recommendations make an impact on their health? And if we need to change things, to make those changes to make this practice better. Another goal is really to make this practice sustainable. Something that is true at present with Alzheimer's disease risk reduction or prevention is also true of other types of prevention, like in heart disease. Not everything is covered by insurance. So right now, our center is funded in large part by philanthropy from your group, WHAM, as well as by our Keep Memory Alive organization within Cleveland Clinic here. And that money covers much of what we do for women here. But we do bill a couple of things to insurance. So there are a few things that fall under the umbrella of prevention that insurance will pay for, but it's not enough. So what we need to do here, and the goal is really to make it sustainable, raise funds so that we can keep doing what we're doing, try to get grants so that we can keep doing this, but also work on that insurance problem. Speak up and really educate, and also just kind of work towards insurance covering some of these things that could ultimately save people as well as companies money in the long run.
That's so great. Well, I think we both have very similar goals, similar hopes and dreams. I think this was a dream, I know, for all of us. I'm really proud of all of us for getting the doors, so to speak, virtually opened to women from around the world. And this will make a huge difference in the lives of, I hope, many, many, many women. And so if you care about your brain, and it is your greatest natural resource, it is your greatest asset. I always say to women, don't think your boobs, your hips, and your ass is your greatest asset. Your brain is your greatest asset. And if you spend a fraction of the time on it that we spend on everything else, you will have a brain that will last you a long time. So this is a kind of turning point for women, for Alzheimer's, and for prevention. So if you've got a brain, and you've got a brain if you're listening to this interview, come and sign up and put your brain, make it a priority, and embark on a prevention path forward. So I want to thank you so much, Dr. Caldwell. Congratulations to you and everybody there at the Cleveland Clinic, the Ruvo Center. Keep Memory Alive, everybody. The Women's Alzheimer's Movement is proud to partner with you. I was saying before you got on that so many people always say to me, where can I go? What can I do? And now we finally have a place to direct people to. So
thank you. And I would say, I just wanted to add that people are coming. So we've had hundreds of phone calls, and we have 110 women who've already started to fill out our online assessment. We also have emails coming in. So I'm really excited. It's not just us feeling the excitement. People are definitely feeling this mission as well.
That's great. And we just opened the doors this morning. So it's exciting. And I think there's going to be a lot more where this came from. So I appreciate it. Good luck. And as soon as we're allowed to be in proximity to one another, we'll be there.
Sounds great. Thank you so much.
Thank you, Jessica. Okay. So that's Dr. Jessica Caldwell, who is the director of the very first Women's Alzheimer's Prevention Center. And you can go check it out online. You can get virtual. Can anyone participate? Anyone can participate. You don't have to live in California. You don't have to live in Vegas. You can live wherever you live and you can participate. You can, some of the appointments are virtual and some of the appointments are in person. So you'd have to go to Vegas, but now you have a reason to go to Vegas, right? I never had a really good reason to go to Vegas. Now I have a really good reason to go to Vegas. But can people around the country participate? Yes, anybody can participate. You just have to be a woman with a brain. That's all. You have to be a woman with a brain. And you have to be a woman who's interested in keeping her brain and getting her brain in shape and keeping her brain alive and keeping her brain curious. So the goal is to stay smart, stay strong, stay substantial, and of course, always stay sexy. So anyway, womenpreventalz.org. Wherever you live, go there, womenpreventalz.org. Or also go over to the Women's Alzheimer's Movement. We are a movement of game changers, instigators, agitators, and committed individuals. And that kind of commitment got us here, and it's going to take us even further. Yeah, you can go see Elvis in Vegas too. Well, yeah, you're right, you can. But you can also go and help your brain and then go see Elvis. And then actually now you can go to Vegas and you don't have to, what's that saying says, you don't have to, whatever happens in Vegas, you don't have to keep it in Vegas. Whatever happens at the clinic, at the center, you can take it out and tell everybody about it. So finally, what happens in Vegas, you can tell people about. And it's important, whatever happens in Vegas, to tell people about, because this is a movement. So thank you all so much for joining us. Congratulations to the Women's Alzheimer's Movement, particularly to Erin Stein and Sandy Gleistein, both of whom worked super, super hard on this, along with everybody at the Cleveland Clinic and the Ruvo Center, and to make this happen. So we miss Patrick, I know. He's not on the Women's Alzheimer's. He's over on Maria Shriver or Patrick Schwarzenegger. He's eating ice cream right now. Anyway, that's not good for your brain. But anyway, these kinds of conversations are. So thank you, God bless, and have a great rest of your day.